This paper looks at a seawater nasal spray with xylitol on COVID inactivation, and this was done in vivo in life, meaning that they actually sprayed it into people's noses and tested the outcomes. In these experiments, they used a commercially available product, Tonomer Lab Penthexol 800. This is a sterile hypertonic solution containing seawater, xylitol, panthiol, and lactic acid. What we're going to focus on is the xylitol in this paper. In this controlled clinical trial, there were 108 patients that were asymptomatic or had mild COVID. There were two test groups. There was a treatment arm with the Lab Penthexol 800 spray, and a control arm that received standard of care but no treatment with the nasal spray. So first, what's the difference between an isotonic and hypertonic solution? An isotonic solution has a lower volume of sodium chloride in the solution, which is set to about 0.9% weight per volume. So isotonic would be equal to or lesser than that. On the other hand, a hypertonic solution will have a lot of sodium chloride in it, which would be greater than the 0.9% weight per volume. Additionally, as I hope you're picking up by now, what is seawater, undiluted seawater? Well, in a clinical sense, seawater is a very specific combination of ingredients. What it is not is going to the local ocean and grabbing a little vial of seawater and using that. Completely different things. Where, unlike saline, which consists of sodium chloride dissolved in distilled water, 99% of seawater's salinity is due to 6 components. There's chlorine, sodium, sulfate ions, magnesium, calcium, and potassium, and that's what makes up seawater in the clinical sense. Now, these are all the components in the Tonomer Lab Penthexol 800 nasal spray, and what we want to do is look at the xylitol, because what we want to try to do is make direct comparisons to the iodocarrageenan and xylitol nasal spray paper that we looked at previously. So we have to break out a little math and some knowledge. In this weight-by-weight comparison, we see that the total weight is 100 grams, which is an assumption we're going to make because we're going to be adding purified water up to 100% of the volume. So in actuality, the purified water is not necessarily going to be 100 grams, it's likely going to be slightly less, maybe something like 90 to 95 grams. But to make this easy, this is what we'll do. So we know the total volume is going to be 100 grams of solution, and we're making the assumption that we're going to have 100 grams of water. We know that 1 gram of water equals 1 milliliter, therefore we're going to have 100 milliliters of solution. Xylitol is a 5% weight-by-weight volume, so 5% of the total weight. So when we have 100 gram solution, that's going to be 5 grams of xylitol. So what we know is we have 5 grams of xylitol in 100 milliliters of solution, which is going to give us 0.05 grams per milliliter. Next, we convert that to milligrams per milliliter, and at our low conservative end, we have 50 milligrams per milliliters of xylitol. And we know this is the low end because we're always going to have 5 grams of the xylitol in a 100 gram solution. But as I mentioned at the start, the amount of water in that solution might be slightly less than 100, so maybe something like 90. So when you have 5 grams over a 90 milliliter solution, that's just going to increase the amount of xylitol per solution that there is. So at minimum, we hit this 50 milligrams per milliliter value. And the reason we took this aside to do this little math lesson is because that's the minimum concentration that was required in the prior study, where it was shown that xylitol at those levels had virucidal capacity against COVID. So we can make a direct correlation between this study and the past study. Diving back in, to be eligible for this study, you had to agree to take part within 48 hours since testing positive for COVID. You had to be an adult 18 years or older. You had to have mild or moderate COVID symptoms or be asymptomatic for COVID. And then other standard study stuff, where the treatment arm of the study was performed between February and March, and then the control arm was performed from March to the end of March, and that was all within 2022. And the subjects performed nasal sprays 3 times a day for as many as 15 days. And then what they're plotting here is the time from first positive test to time to first negative test in the study group, where the dark black line is the treatment group and the dotted line is the control group. What they found is that within the first 5 days, there was an earlier clearance in the treatment group. However, by day 7, there was no longer an impact, where they observed beneficial effects for the treatments lasting up to 5 days, but vanishing from day 7 onward. Therefore, using early treatment of the Tonomer Lab Penthexol 800, patients were more likely to become negative 2 days before controls, but only during the first 5 days of treatment. Therefore, this xylitol seawater nasal spray combo is likely only going to be effective as an early treatment, so within the first 5 days of symptoms, and then after that, you might want to switch to something else if you're using this. Meaning again that seawater and xylitol nasal sprays are likely not going to be your best choice if you have an active COVID infection.